what I want to talk about today, first of all, is I want to talk about the work that's going on with testing because what we're seeing right now is we are seeing our testing capacity grow, which is very, very important because we know the more people that we can get tested, the more we can identify those individuals who are positive, and then we can take the steps necessary for them to be quarantined, for us to contact their contacts, and contain the growth of this virus. So the good news is our capacity is growing, and it's growing in particular, as we've talked about over the last few days, with our federally qualified health centers. These are the health centers on the north side and the south side. There's 7 sites now, 5 different organizations. And if you are showing symptoms, feel free to call 211 to get information as to where you should go. Earlier today, I was on a conference call, and the director of the 16th Street Health Clinic in particular was talking about how initially they had somewhat of a surge where they had individuals who came in, but it has tapered off somewhat. The point there is the capacity has grown, but we are not seeing as many people getting tested as we would like to see. So right now, these different health centers have a capacity of roughly 600 tests a day, although they're not utilizing all those tests. The reason this is so important is because both the federal government, the state government, here locally, we have all identified testing as one of the major ingredients to help us work our way through this. And the governor has set a goal of 85,000 tests a week. If you break that down in the days of the week and in our population as a percentage of the state's population, we've estimated just on a pure population standpoint, not on a intensity of caseload, which would make it much higher, but on a population per capita threshold, we would need about 2,000 tests per day. We feel as though we are making progress with a combination of sources to get to that goal. And those sources include, of course, first and foremost right now, as we're going to talk about a little bit today, is the federally qualified health centers, the health centers on the north and south side. In addition to that, we've got work that's being done by the hospital systems, and they've got a number, and we'll have more news about that in the coming days about the work that they are doing. In addition to that, we have the work that's being done by the National Guard. And finally, we've got what we call the site-based, or what I call the site-based, where we go in whether it's a business, whether it's a long-term care facility, and we do some intensive testing of employees, and in the case of long-term care facilities, patients, to make sure that we're covering as many as we can. Once we add all that together, we're starting to get to the point where we need to be, at least at this juncture. And I say at this juncture because the governor has set that 85,000 number for his goal by the end of May. He's also made it clear he wants us to be one of the national leaders in per capita testing, and I agree with that. We've also been in conversations with our fire department to see how they can augment this as well. So the whole point here is that there's a lot of work that's going on to increase the capacity of testing. But we want to make sure that those individuals, whether you have a regular healthcare provider or not, if you are showing symptoms, and the symptoms, and Dr. Weston can talk about what the specific symptoms are. If you are showing the symptoms of COVID-19, please make sure that you are contacting one of these entities, and you can do it through 211 so that you can get tested. The reason I am making such a big point about this is over the last 8 weeks, we clearly have had a migration of criteria that I think has caused some confusion. And it seems like a million years ago. But if you go back to early March, the questions were, well, did you know someone who had traveled to China? Did you know someone perhaps who had been in Seattle? Then we went to make sure that we were testing those individuals who were going to be in a hospital setting or those people who were treating them. We're still working to get to the first responders. But the next step now is to do testing of as many symptomatic people as we can throughout our community. And so that's what our goal is right now, to do more of that. So again, the capacity is there. The capacity is there, particularly in our health centers, to have this done. So please make sure that you're contacting one of these health centers, and you can do it through 211 if you are showing any symptoms of COVID-19. The more we can do to identify you, and the quicker we can identify you and have you take the proper steps that are necessary for you to take care of yourself, or if hospitalization is necessary, the more we can make this a healthier community. So I'd say that's the big challenge we have right now. We're continuing to expand our tracing efforts. This has been something that obviously started very, very quickly on a grand scale. If you think about it, the way I look at it is March 13th, we had our first case. By April 7th, we had 979. And today we're going to be well over 3,000 cases in Milwaukee County. And the tracing that's done here is unlike other tracing that might be done by the health department, because here a much more casual encounter is going to result in having you have to be traced. So that obviously multiplies the need for us to have more tracers. The good news, of course, is the more people stay at home and they're safer at home, the fewer contacts they're going to have that our tracers are going to have to follow up on. That's one of the major reasons it's so important for us to continue to honor the safe distancing that has been part of what we've been trying to do now for going on 8 weeks. So with that, I'm going to turn it over to our County Executive David Crowley, to talk a little bit about this from his perspective. Mr. County Executive.
Thank you, Mayor Baird. You shared a lot of information. Not sure what you left for me, but the daily reminder when we think about these numbers and these briefings and the data, we have to remember that these are real lives behind this. And so we have to make sure that we continue to practice social distancing, continue to wash our hands, and follow the CDC guidelines, quite frankly. And so I want to make sure that folks understand, again, and echo the mayor's comments. If you're experiencing any type of symptoms, make sure to call and schedule an appointment with your medical provider. Call 211 to make sure that you can get in contact with somebody to schedule an appointment so you can get tested. We know that we have to see an increase in testing in order to make sure that we're doing the right thing throughout Milwaukee County and throughout the state of Wisconsin. And so we know that many people have stepped up, especially our community health centers. Since April 20th, they've done over 1,200 tests. And so we need to make sure that we're utilizing that capacity. They're only using about 20%. So we need to make sure that folks particularly who are uninsured and do not have a regular doctor, have access to those tests. So making sure that they have access and call those folks to schedule an appointment is extremely critical. But I also want to make sure that I also say thank you to many of our essential workers. Today, this week is also National Corrections and Employee Week. And I want to say thank you to those who are at Bell Phillips and the House of Corrections that are in our jails, making sure that we have safe places for those individuals who are currently incarcerated, but also keeping themselves safe. So I want to say thank you to all those folks. And that is my update, and I will give it back to Mr. Bryan.
Thank you, County Executive Crowley. And next we'll hear from Dr. Weston. Please go ahead.
Thank you, Brian. Good afternoon. So first, looking at our numbers, we have 3,447 cases of COVID-19 confirmed in our community and 196 individuals who have died. Today, I want to touch on a few items that have been gaining attention, but also may create some confusion due to differences in how they're presented to the public. So first, testing. Up to this point, there's been a national shortage in testing supplies and availability. And for that reason, as the mayor mentioned, in the beginning of the pandemic, it was recommended that we only test those who would be hospitalized. And as testing capacity has gradually increased nationally, and our state has made efforts to secure more supplies, we've responded by increasing testing availability in Milwaukee County. And this includes 7 community health center sites and multiple more health system supported sites around the county. These testing sites are open to anyone with symptoms of COVID-19. So that means cough, shortness of breath, or difficulty breathing. This is often accompanied with fevers, chills, headache, sore throat, muscle aches, and a new loss of smell or taste. So you can simply call 211 and you can get connected with a testing site appointment. These sites are also connected with health providers to ensure that you have appropriate medical follow-up to discuss and manage the result of that test. So increasing our testing is critical now to understand where cases in our community are and to deploy appropriate resources to those areas. Having expanded testing established and ready will be imperative in the future as we scale back stay-at-home orders to be able to rapidly identify and control any outbreaks that may occur. The second issue I want to talk on is masks, and specifically homemade cloth masks. So while these masks should not provide false reassurance on the level of protection, they have been shown to protect others from the respiratory droplets that we release every time we cough or sneeze, and every time we talk, or even every time we breathe. It's a good idea to wear a mask whenever you're in a situation where social distancing is difficult. So stores, workplaces, and this goes for whether you're sick or not. And while you wear a mask in public places, remember that the protection is still minimal and you must continue to social distance and try your best to keep a 6-foot distance from those around you. And third, treatment. So there's been much interest initially in hydroxychloroquine for treatment of COVID-19. This was based on a small and flawed study that was widely promoted in many circles. Subsequent research has shown that hydroxychloroquine is likely not helpful and may in fact be harmful. More recently, remdesivir, an antiviral medication, has, in more substantial, well-performed research studies, initially been shown to have modest positive effect on treating COVID-19 patients. This continues to be studied, but does appear to show some real promise. So I think this demonstrates the importance of regulation as well as careful review and study of medical treatments before they are promoted. The residents in our county have done an outstanding job of social distancing, and as a result of that hard work, we haven't seen the overwhelming number of cases and deaths that would have occurred should this pandemic have spread in our community without social distancing measures in place. So to be clear, as we watch the curve flatten and hospitals not being overrun, the success we have seen is not in spite of social distancing, but rather because of it. And likewise, this is not a time to call social distancing unnecessary, but a time to realize the substantial benefit it has afforded us. We can now complete the development of the infrastructure to allow for the gradual and measured dialing back of social distancing. Unfortunately, we are far from seeing the end of the effects of COVID-19 on our lives and in our community. And through testing, tracing, healthcare capacity building, and careful monitoring, we can prepare as a community to move to the next phase of this pandemic and get back to a somewhat more normal way of life. Thank you very much. Stay safe, and I will hand it off to Director Rausch from Greenfield Health Department.
Thank you very much, Dr. Weston. As mentioned, I'm Darren from the Greenfield Health Department, and it is my pleasure to provide the perspective from our 11 local health departments throughout Milwaukee County. Collectively, we understand the impact of the Safer at Home orders on your lives as residents over the past several weeks. We continue to thank you for your compliance. The data continues to show and support that Safer at Home is working and that we have done our part to flatten the curve. However, we have seen an increased number of cases over the past week, and we'll be more closely monitoring these in the coming days and weeks. We do know, and has been talked about previously on this press briefing, that increased testing will identify more cases of COVID-19. The rates of positive tests will be an important indicator for us to monitor as we continue to track the disease in our community. Going forward, public health will need to be more aggressive in identifying and investigating COVID-19 cases, completing contact tracing, and appropriately quarantining those who have been exposed. These measures will be important as we continue to work to reopen businesses and dial back social distancing in the coming weeks. I encourage you to continue to please do your part to stay home and save lives. Thank you.